Welcome to Bending Over Backwards with James Adkins, where each week we take a deep dive into what it takes to break through barriers and change the game, whether that's in medicine, business, or life. Today I'm sitting with Dr. Ken Oda and Dr. Azmi Nasser. Dr. Nasser is one of my best friends and my partner. He's our medical director at our practice. And Dr. Oda, his good friend, is a concierge physician here in town. And tell us a little bit about yourself, Doc. I've met you before, but don't know anything about you really. So.
Yeah, you met me when I was going through a very agonizing time in life when I had a herniated cervical disc. Born and raised in the Bay Area, moved out to Arizona for my residency program in family medicine. Mm-hmm. And the idea was to always go back to California, but Arizona got its claws in me, it grew on me, and I've been here ever since.
How do you, now I know you have a concierge practice, so how do you, how has that shaped your decisions? Have you noticed any of the way you practice since you've gotten into concierge medicine? Do you see regular patients too, or is it all 100% concierge medicine now?
I do. So if we were to call it if you look at it like a pie chart, 90-something% of my patients are concierge. And then I have some patients that are kind of grandfathered into seeing me via their standard, insurance claim-based type of visits. So I see some Medicare, some commercially insured patients. But I ended up doing away with that. I don't take any new patients via any commercially insured. So it's all via the concierge membership model. In terms of how I practice, I wouldn't say anything has changed. Certainly, I think like with any physician, the way I do things evolves over time. Mm-hmm. Maybe I have a bit of a cleaner, more updated way of how I counsel on things, or procedurally how I do things. Sometimes I pick up tips from other physicians that I correspond with, and I incorporate those kinds of things into my practice. So. It's an evolution. It's just a constant evolution. And that's one of the things that I love about it, is that it's always there's always room for improvement, and we learn new things, and so it keeps me excited.
And personalized medicine, how do you see it evolving here the next few years? I mean, what do you see happening?
Specifically, well, I mean, hard to say, but I think one of the things that is very obvious is that people are now taking more ownership of their health. Mm-hmm. They're asking more questions. They're expecting more from their healthcare providers, and I think that's good. Sometimes it's tough because there's just so much information out there that we don't know how to juggle all that, especially if you don't have a medical background. So I think we're kind of moving to this place where consumers, our patients, they're more keen on finding physicians that will work with them on the things that matter to them, as opposed to the other way around, where traditionally we as physicians dictate what should be important to them. And that's not always the right way to go. Mm-hmm. So I think, especially in my practice, what I'm finding now is that I'm being more open to what direction my patients want to go in with the things that matter to them in their health. Of course, if I see that they're wanting to go down a egregiously wrong pathway, then of course I stand in their way. But for the most part, I think everybody for sure wants to feel better. Mm-hmm. People want to look better. And I think more importantly, people want to live longer with more function. Mm-hmm. So that's where I see things going, is one, people paying more attention to their health, but being interested in being functional for as long as they possibly can.
Mm-hmm. And you, Dr. Nasser, I mean, you work in more of a traditional system, but we have kind of concierge type patients. So you have balancing that, a regular practice, a typical medical practice, and then weaving in a little bit of a concierge type service with the patient, that's challenging, huh?
Absolutely. I think we kind of have like a reverse ratio. I think we're about 90% commercial insurance or it's state, federal funded, and then about 10% are concierge. And the concierge comes into like if someone needs a procedure and they don't want to wait through the and jump through the hoops and the authorization process with commercial insurance, all insurances really. And so we do end up tailoring how we approach each of those patients because it just like, hey, Ken nailed it. Like patients are consumers now, right? They're not just patients. Sure. And they do.
It's not patriarchal anymore. They come in, they're kind of the boss on some level, aren't they?
And we are in a service industry for a great part of it. Yeah. And so if someone says, I want to have this procedure, how soon can I get in? I'm paying cash. It's tomorrow, right? Yeah. Whereas sometimes some patients don't understand with their insurance. It takes 2 weeks to get authorization. And guess what? Authorization doesn't mean payment. Sure. So they don't understand that. So then we have to counsel patients on that. But I think it is interesting to see a lot more patients taking control of their health. They want to be more functional, and
they're engaged more. They're much more engaged than they used to be.
Which I'm grateful for, because like how many times do we throw out lessons, not so much edicts, but just tell them this is what you need to do to stay strong, and then they don't do it. I'm finding more and more people are holding their cell phone with better posture. They come and tell me that they're doing their core. So we're getting through to some, which is nice.
Well, I think there's more information out there now. And especially with the advancements of social media, information that was not available to consumers before regarding various aspects of healthcare. Now that that's accessible to them, I think some are more empowered to hold us accountable for what we can help them with.
They're the Library of Alexandria at their fingertips, don't they?
Right.
That just got AI.
Yep.
Or Google. It's cool. I mean, but like you said, it's kind of information override. With you guys have to sort through all that with a patient in a short amount of time. They may have more questions. What unique challenges have you found with the concierge practice that you didn't necessarily have with your prior just typical medical practice?
Yeah. I don't know if I would call them challenges. There are some aspects of this care model that I expected to be there. For example, all my patients have my cell phone number. So I do get called or texted at, let's just say, inconvenient times. But also that's what I expected to happen. So there's just this understanding that it's all right. That's what I'm here for. That's what I do. Thankfully, for the most part, those encounters, they're not so long that it really puts a wrench in our plans with the family. Sure, I've got to take a call here and there, and that's just understood. Sure. That's what I do. That's what I've signed up for, and it works though. I can tell you that, interestingly, you guys have probably noticed this too. It's always around Friday, 4:30, 5 p.m., a problem that's been festering since earlier in the week. Now, all of a sudden, it's really a problem, and it's got to be talked about right now. And that's okay. Usually these situations, there are things that can be dealt with on Monday.
Sure.
But it's nice for them to have the resource. That's what they're paying for, right? Is to be able to have a professional relieve them of whatever anxiety that they're having about
just information they need. And that's, I wonder too. I wonder if the medicine changes. I doubt either one of you practice different medicine with a patient, really. You're probably just tethered a little bit more to that patient in a concierge practice, or a patient that you're doing a ultra minimally invasive procedure on, Dr. Nasser, that maybe needs a little bit, I would say, hand holding. You're more tethered to that patient versus the medicine changing a lot, right? I mean, and you're gonna practice at the standard of care. You're gonna give them the best medicine you can.
Absolutely.
But the relationship does change when you're in a concierge type, I would assume.
Sure, especially with so my concierge practice is it's primary care, right? So it's not a specialized.
Sure.
I'm not doing surgery. I'm not doing pain management. It's general practice. So I intentionally have designed it in such a way that I have regular meetings with my patients.
Oh, okay.
Let's call it, at least quarterly, and then more for those that have
Disease.
a bunch of chronic disease. Those that I worry about more, I want to see them more often. Those that, let's say, have psychosomatic illness that they just need more regular
All of
reassurance.
us, right? All of us have little psychosomatic.
Yeah. So it, and I can only determine that after I've met them, a couple of times to understand what is it actually that they need, because sometimes they won't tell me. They won't actually tell me what it is that they need. It's I figure it out over time, and then I know, okay, this patient, I need to see them every month. This patient, that's okay. I can see them Q6 months. They don't really have that much going on, and they're pretty solid in other aspects of their life. Others need me more. Others need me less. I have some patients that I haven't seen in a while because they just like the notion that they can contact me if they need me. But for the vast majority, there are concerns that they have addressed every time we meet. And what that does is it develops this relationship where when something happens on a Friday at 4:30 p.m., I know them so well that I can reassure them, or I can tell them, oh my gosh, yes, that is something very serious. You need to go to the hospital right now.
Yeah. I guess that insight you're able to get from just spending more time with them. I mean, you see a lot of your patients once a month, Dr. Nasser.
Or more often sometimes.
Yeah. And you do gain insight by being around somebody more. I mean, there's, right? I mean, it's...
Yeah, absolutely. And, different patients, the psychology of medicine, that's not going to change really. Like, yeah, patients have more information, but how we approach each patient is different. Like, someone will respond maybe to a stern talking to by their doctor, and someone really wants a buddy to tell them, like, that's not right for you and you need to do this instead. If you were my best friend, this is what we would do. And some respond better to that, whereas some people would just totally ignore that. Some people need direction, and some people want to discuss it so that they can do some more research and figure out what they feel is best for them, and that's okay too. But everyone's different. We're all different beings.
Yeah. So I'll take you guys, your personal lives. You guys are fighters. You're both, you're grapplers.
I'm retired. This guy's active.
You're big into some form of mixed martial arts, aren't you? Do you do?
Yeah, I've been a student of Jiu-Jitsu.
Jiu-Jitsu, okay.
Since 2009. Actually started Jiu-Jitsu here in Arizona way back when it was still kind of, it wasn't as mainstream and commercialized as it is now. And I just came up the ranks.
You were in it before it was cool, basically.
Yeah. Well, it was interesting because when I started back then, somehow jiu-jitsu would come up in conversation, and most people didn't know what I was talking about. So they assumed I was talking about karate or kung fu or something along those lines. And so I'd always describe it as, well, you think about it as like wrestling, but, with a uniform on. And eventually became more popular over time, and there are more schools now. So people know what you're talking about when you bring it up. But yeah, I just got my black belt back in June of 24.
Congratulations.
So proud of him.
Yeah, that was
quite an accomplishment.
Well, it was because you met me right before I got my black belt.
Okay.
And one of my worries at the time was, man, I was so close to that point, but the herniated disc I had in my neck, it was preventing me from moving properly. I certainly could not compete like that. But I don't know. I guess the powers that be, my professors thought I was ready for it, and here I am.
And you treated him. You took care of this guy, didn't you?
Yeah. And as an honor and a privilege, he's one of my best friends out here.
Yeah.
And I appreciate his trust. And that means a lot. Like, he has access to almost anyone out here in the Valley. And I'm always here for him, you know.
How did you two meet each other?
It was actually February of 2016. You like how I know that?
I do.
Like right off the top of my head. Yeah, it was February 2016. I remember because I was out here. I was doing an interview, and I was suited up, and I was just trying to get a bunch of buddies together. And I told them, well, since I'm wearing a suit, why don't you guys put on suits too, and we'll make it sort of like this mafioso dinner type of thing. And Azmi was brought to the dinner by Sean, right? Another mutual friend of ours, who I also met that night, I think. Didn't I? Yeah,
I thought you knew him before, but was it that your first time meeting him too?
It was through Era.
Era's the man.
Anyway, we met at a dinner that I randomly put together at Blue Hound in downtown, and
it became a thing. I didn't know. So next year is our 10-year anniversary. That's sweet.
That's right.
Yeah.
We haven't gotten together in a while, but
yeah, we're way overdue. But it's hard to manage. I mean, so you have 2 kids now.
Got a 1-month-old and got a 16-month-old.
Wow.
Yeah, so, and your own practice. So like when do we get spare time to meet up? Like, hey, honey, I'm gonna just go meet the guys for, you know? Yeah, that has to be planned out like 2-3 months in advance.
Sure.
Yeah, we have a calendar now on our refrigerator, and my wife has a color for her things, and the kids have another color, and then I have a color. So
You don't see much of your color in there.
there's not too much.
Roles change for
Actually,
dads.
but mainly it's teaching jiu-jitsu, covering a shift, podcast.
Sweet. Yeah, are we on there? That's good. And your podcast too?
So take us. Who was one of your mentors? As you know, you became a physician, obviously. Who was? I suppose you have a mentor that was in your combat sport, but what about just in life? Who was one of your mentors?
Well, my mom played a really big role in my life because my parents divorced when I was 2, and so she was a single mother raising me, and so she had to take care of the household and raise a son. So I would say from the very early days, seeing my mother work so hard instilled in me that, okay, I need to follow suit. I must work very hard as well. It was just, I was led by example.
Your mom's amazing. I've met her. I've had the honor of taking care of her too.
Oh, cool.
And she's amazing.
Yeah, she's
and
amazing.
I love that she instilled that in you. And the fact that she made you play piano every day.
Yeah, she was a bit of a tiger mom. Her intentions were very good. But yeah, as I grew up, she had a pretty solid influence on my going off to medical school. Really glad she did that because my vision was more on like the music scene and
That's a long road to hoe.
having more fun.
Music scene.
So
Yeah.
but as I went through my medical career, there was actually a geriatrician that was one of my professors in residency who, just by watching how he was with patients, very gentle, very knowledgeable, but also very firm when he needed to be. I thought it was amazing to watch this man know how to read a room, know how to be with patients of different ages. And gosh, watching him work with the elderly, that was something very impressive to me. And that was something that I wanted to emulate. So I would say that perhaps a lot of the way that I my bedside manner comes from watching that guy. And that man is Dr. Edward Perrin. If anybody's ever looking for a very kind geriatrician to take care of their family.
He's in Northern California.
No, he's here.
Oh, he's here.
He's here in Arizona.
Oh, okay. Mm-hmm. Okay.
I haven't talked to him in a while, but I wonder if he's. I wonder where he is now. But I do know he's here in the state, here in Phoenix.
What about you, Dr. Nasser? One of your mentors?
Besides, I mean, he stole the whole parents thing. Of course, immigrant parents both worked. Both my parents worked. My mom worked a full-time job and came home and cooked dinner, right? But just to get into this specialty, like the way I chose my specialty, I thought I was gonna do like orthopedic surgery, or family practice, and then do sports medicine. I knew it was gonna be musculoskeletal. And one of the surgeons I was working with talked me out of family practice. Like, you don't want to do that. If you're not going to do surgery, then think of physiatry. And I never even heard of it in med school. Like, it took basically 3 years in medical school to figure out what is physiatry. And so I shadowed one of his friends down at Kaiser in San Diego, Dr. Michael Jaffe. So if anyone's looking for a good book, Play Golf Forever is a great book. If you play golf, do you play golf?
I have golf clubs.
Okay, that's nice.
And the few
That's a
times
good
I have
answer.
played golf, it's just been a riot.
Yeah.
Balls going into the water, into people's homes.
I decided, well, besides him writing that book and being my mentor, he was excellent. I rotated with him more than once, but he really helped me decide that this is the route I wanted to go. So I really owe him credit for that. And I've kind of lost touch with him too, which is sad. I tried to just contact him recently, lost that, but that's not his number anymore. He's probably retired. Good for him. But I was going to ask you a question about just being here in the Valley so long. You definitely know a lot of different doctors, and especially for your concierge patients. How do you point them in the right direction? How do you pick the specialist you're going to refer them to, and what happens when they come back and give you a report?
Mm-hmm. Oh, yeah. So, great question. I have, do we even use the word Rolodex anymore? So
I would. I'm older than you guys.
I was going to say I have a Rolodex of specialists that I routinely interact with, correspond with here in the Valley. And what's interesting is that when I make a connection with one, I'm happy to send them a referral. I learn a bit about them. And then when my patient comes back, they tell me, yeah, great person. They had a great bedside manner. They listened to me, etc. But every now and then I do get not so positive feedback from the ones that I actually thought would work very well. And that, I think what that does, it just speaks to the fact that, not every person is going to jive with someone else. And it doesn't matter. It doesn't matter if, you think they're a great person.
Yeah.
They're two great people. It's just sometimes it just doesn't work out.
Yeah.
In the same way that I think some people that go look for a psychologist, it might take them 2 or 3 different.
I think they use the term coupling, like the psychologist and the patient, they're coupling.
Yeah.
They have to connect, don't they?
Exactly.
Yeah.
So for me, what happens is if I start to hear a pattern of not so positive feedback, usually what ends up happening is I begin to consider another specialist for that type of for that specialty. That doesn't happen very often, but I think that also speaks to just that when we age, as we go through our practice, some of us, we start to change.
Yeah.
Sometimes for the better, sometimes not so much. But
Not everybody continues evolving.
right.
Some people, fortunately, we've had an employee like that, Dr. Nasser, that just said, no, this is all I want to do. And that's a warning sign, isn't it? When a doctor or a practitioner goes, no, I'm kind of comfortable right here. I've got this knowledge base.
Yeah, they're complacent. They don't want to grow.
Things are
That's a
moving so
problem.
fast. Yeah. It's
Yeah.
a big problem.
Well, even in my own practice, I've had patients come and go, and that's just how it is. Even in jiu-jitsu, you have people that come in. Gosh, I've been doing jiu-jitsu for what is that?
2009, 17
almost
years, 16 years.
Almost 16 years, and that's how it's been. Let's say this is not an accurate count, but let's say for every 3 people, 4 people that come in, 1 stays. And so you meet a lot of people over this journey, and you end up having a really close relationship, almost like a brotherhood, a sisterhood, with these core people that have stayed along the way. There are people that I've been training with since not necessarily my day one, but pretty close to it, that are still training with me. But I'll tell you, the number of those that have left has been far greater. And I think it's one of those things that where jiu-jitsu is very difficult. Just because you get a black belt doesn't mean, okay, well, I know everything now. I don't have to train as much. No. The people that are coming up the ranks, they're training really hard. So you always, and they will keep you honest. You miss a few days, woo, when you go back, you're going to feel it. And so I think the same thing with medicine, right? For us to be sharp, for us to be good at what we do, we cannot become complacent.
So true.
Otherwise, what are we doing? We're practicing the way that we did 10 years ago. And how is that
how
any
often
good for any of
It
the people that
changes
we're
so much, you know?
Yeah.
Yeah, it's not a part-time job. You know, it's interesting when I obviously I just run a company, but talking to physicians that are part-timers, like, I don't know if it's a part-time job. It's a full contact sport. You got to be in it, right? Because people are relying on you to be up to date, to understand. There's so much knowledge out there to lead them in the right path. It's a challenge. How do you guys unplug? Let me ask you that. Jiu-jitsu is obviously one thing for you. Practicing medicine stressful. Azmi, you see a ton of patients. You're one of the busiest doctors I know. How do you guys unplug? What helps you the most? Clear your mind.
I think kind of like I unplug in the morning or like replug in when I work out and meditate in the morning. That's rejuvenation. And then I meditate in my car before I go in my house. And I tell myself, I love my family. I want them to love me. Like, so you gotta erase that day. You can't bring home, because you talk to 35 pain patients in a day, it's gonna empty your bucket, right? So I wanna have some left in that bucket for my family. And hanging out with them helps unplug. Although that has its own stresses, you'll find out as they get bigger. Like what you're feeling now, yeah, it's hard, that caffeine and delirium phase, but it gets more challenging. But like just being with the people you love most in the whole world, that helps you unplug.
How about you, Dr. Oda?
Well, so jiu-jitsu is a huge part of unwinding. My wife, my kids, just being with them. One of the things that I'm trying to get better at is being in the moment. Something that I have not been good at, and still I need a ton of work on that, because how can you truly unplug your thinking about someone that's sick, someone that you're taking care of, when you know something's going on, but you don't know exactly what's going on, and you're still in the middle of the workup? It's really hard for me anyway. I don't know about others, but it's hard for me to just say, okay, well, it's the end of the day. I'm not going to think about that person anymore. I do it to a degree, and having my wife, my kids around that certainly helps. Jiu-jitsu, I would say, of course, working out, lifting weights, cardio, that's all great. But there's something very special about jiu-jitsu, which is that when you are in a sparring round, it's amazing. You really cannot think about anything else. Because your training partner is literally trying to choke you to unconscious, or they're trying to trick you to
throw you on your head,
throw you, break your arm, break your ankle. So you have to be
living in the moment.
You have to be very, very focused, And so our rounds range anywhere between, just depending on what we're doing in practice, anywhere between 3 to 10 minutes. And so, your cardiovascular system has to be on point. Your strength has to be on point. You have to be aware of what injuries you have so that you can avoid being in situations where you're going to exacerbate that injury. But I'll tell you, that round ends and you're thinking nothing about the outside world, just what's happening right there. And when you leave the gym, of course, you have this feeling of euphoria, but then slowly, the stressful thoughts coming back.
Sure.
So that's why I think it's so important to train regularly to be able to get that decompression.
Is that pretty much daily for you?
It used to be.
Close.
Now with a 1 month old, 16,
Congratulations
16-month
on
old,
the new baby. Yeah.
and of course the lovely wife. That has taken a hit for sure.
Mm-hmm.
Hopefully, as things stabilize, I can get back, and my goal would be to train at least 3 times a week.
So what's your morning routine? I know what this guy's is. I'd like to ask that from people, kind of a morning routine to kind of get them focused for the day. I know for me, it's crucial. If I don't have that foundation, if I didn't sleep the night before, if I don't have that foundation, I'm not very effective. I see this guy at the gym, so I know what his morning routine is. What's your morning routine? What do you do?
Let's see. Well, now it's
Oh yeah, the new baby.
it's if I'm waking
Changing a
up,
diaper.
if I'm waking up with the baby on my chest, putting her back in the bassinet, wiping the spit up from my chest, and waking up my 16-month-old, playing with him for a bit, and then hitting the weights. So we have a weight room in our house. So I tackle that almost every morning. I try to lift weights every morning. Sometimes it just doesn't work out that way, but it's at least something that I don't know how to say it. It snaps me into the day, and knowing that I've done that hard thing as the first part of my day kind of sets the tone.
Mm-hmm.
I wish I could be doing jiu-jitsu every morning, because that has a very unique effect on your central nervous system at the beginning of the day. Don't know how to quite describe it, but it's very meditative.
Combat sports for first thing in the morning.
Cyrus is like 5, you can wake him up and start rolling with him.
Yeah, I used to actually go twice a week for our 6:30 a.m. class. Right now, it's just logistically it won't work for a while. But I'll tell you, that gets you ready for the day, no doubt. And I'll tell you, when you do that, then the little things, the things that are inevitable during the workday, I don't know, the bickering, people yelling, upset family members, upset patients, all this stuff just becomes
kind of noise, background noise.
just not as you don't react to it as much with your fight or flight system.
Yeah.
Same thing.
Yeah. It is dampening down the nervous system a bit, isn't it? You want that energy to focus, but you don't want that the sympathetics to kick in from everything that goes wrong in a typical day, because it's going to happen.
It's going to happen. Things go wrong.
Yeah.
It's going to be a Scheisner sandwich, as I tell my kids. You're going to have one today. It's going to happen for sure. And so what about motivation of becoming a doctor? You said your mom was a big mentor of yours, watching her, claw her way through with just, being a single mom. But what made you want to be a doctor?
I think it was just the notion of being able to take a broken person and make them whole again. When I was a kid, I liked tinkering with things, electronics, taking them apart, looking at the insides, and then putting that thing back together. It could be anything, like a cassette player back then, the toys that I had, different electronics that we had in the household. I always enjoyed putting those like model cars, model airplanes together. So, it's as simple as an idea as that. Just taking somebody that's broken and making them whole.
It's a worthy goal for sure.
And I think what's bittersweet is that what I've learned over time is that I can't fix everybody. And I think it doesn't matter who they see, they won't be fixed. But you can be there. Yeah. You can be somebody who listens when nobody else will.
Yeah.
And I feel like a good portion of the patients that I see, I feel like that's what it is. I'm mainly listening, therapeutic listening.
Mm-hmm.
Yeah,
it's a good skill. My wife tells me I need to polish that one up more. Listening.
I'm working on it.
Yeah. Lifelong aspiration. What would people be surprised? If I ask you, what would people be surprised to find out about you, Ken? Someone, Dr. Oda is this. What would you, something unique would you think your patients would be surprised to find out?
Gosh, maybe that I had a I had a punk band when I was in high school.
Wow.
Carried that on through most of college and just the very beginnings of medical school. It pretty much trailed off at that point. But we recorded we've recorded 2 albums. One album is actually, I have a big box at home of the CDs that we didn't sell. And they're still wrapped in plastic.
I want one. Yeah, I want one of those.
They're still wrapped in plastic. So I guess that's the first thing I can think of off the top of my head is that, I used to have a band. I was the lead singer, played guitar, and we did a little bit of touring as well.
Not piano?
When we would do our acoustic, and I put that in quotes, acoustic set, I would take my keyboard.
Okay.
So for example, one time we played at this wine bar in Saratoga, California. And I think one of the songs that we decided to cover was something by Sting. And so, I played that on Sting. Otherwise, we had a guitarist, we had a bass player, we had a drummer. So mainly I was just focused on vocals. No, I will not sing right now. I
got a story though. Do you remember when we did your tenotomy? When I did your tenotomy? So I listen to punk. Punk is like my favorite genre.
Okay.
And so we're listening to it in the OR, sometimes to the dismay of my nurses and X-ray tech, right? And he's coming in and he's gonna lay down on the OR table, and he's in the middle of talking. He's saying something. I wasn't listening to him. I was listening to my music, and he goes, "Is this unwritten law?" So he knew. He's just like, "Dude, I've played with them before," and I was like, "Wow, that is random." So that's how I learned about his musical endeavors.
Very cool.
Could have been any other band. It just happened to be that.
Yeah,
that was fun.
Been a fan for a very long time. Interestingly, so I have a picture of myself and the lead singer from like 12 years ago or something, and they recently played here in town. And so my wife and I, we stayed a bit late to try and see if we can snag a picture with him, and we were able to do it. He invited us into the camper that they rolled into town with. And so I put these 2 pictures side by side, just like they're about 10 years apart. So that was kind of cool. We both looked very young, and now we both look very old.
You're still young, man. You barely passed that 4 decades.
Punk rocker to concierge, internal medicine doctor. Very cool. Very cool.
Yeah.
Those were fun days.
Last question. How would people find you, Ken? Dr. Odo, how would people find you if they were interested in potentially being a concierge? If you're taking new patients, I don't know if you're taking new patients, but your information.
Yes, real easy. drkenota.com, drkenota.com. That'll take them to my website. A lot of information on there. What I like to do is, for anybody that's interested in concierge medicine membership, they're free to come have a complimentary consult, meet and greet, as we call it. 20, 30 minutes just to kind of have a dialogue, and mainly as to see if we're a good fit for each other. Because what I try to do is make sure that patients feel comfortable with me and the environment, and vice versa. Because sometimes folks that come in for their meet and greet, I feel like maybe I'm not the right one for them. And certainly I wouldn't want to take somebody's money knowing that I'm not going to really do them much of a service. So that's why I think that meet and greet is very important. My medical assistant, Jennifer, mans the clinic phone, 480-365-8035. And she usually always answers. We don't have a telephone tree or anything.
That's service.
we
Someone
keep it old
answers.
school.
That's great. That's great service. What about you, Dr. Nasser? What would people be surprised to find out about you?
Maybe they would be surprised that I love punk music and I was like a punk skateboarder kid. They just didn't know. They think, you know.
You're an amazing snowboarder. That's for sure.
Well, thank you, sir.
Sure. Not a good kite surfer, but amazing.
No. Yeah. It's like kite surfing is one of the only things I've ever quit. Like I tried it once. I'm just getting dragged along the water. I was like, this is terrible. And then I never did it. Who knows? Still, you know, there's still time to try other things.
That's right. I hope today's episode helps you stand taller in your own shoes and that you learn something about concierge medicine and two humble, brilliant doctors that were here today. Thank you.